podiatrist in town. He had a patient who had a right lower extremity wound that he tried everything and it just did not resolve. He ordered a CTA, he ordered an ultrasound, and he saw that there were monophasic waveforms in one of the arteries below the knee. So he asked me if I can take a look at it, and did the angiogram with basically my my go-to algorithm: contralateral common femoral artery, go up and over, and shoot the angiogram. And after shooting the angiogram, for a below-the-knee case, especially for wound healing, you want to ensure that you have good inline flow to the region of the wound. In this particular case, the wound was in the dorsal aspect of the foot, and the angiogram did reveal a pretty long segment occlusion of the distal anterior tibial artery. We were able to get across, and once we got across, I used a HawkOne S. We're able to do multiple rounds of atherectomy followed by chocolate angioplasty, and the results were fantastic. The podiatrist was able to continue wound healing, and the patient had good granulation tissue afterwards. It's a good example of how you can really build a good referral base with your podiatrist in wound healing.